Okay, so today we're doing a deep dive into OpenAI's new product, ChatGPT Health. It was just announced on January 7th, 2026. Our mission here is to figure out, what it actually does, and maybe more importantly, how it handles all your sensitive information.
And this is a huge area for them. I mean, we're talking about one of the most common ways people already use ChatGPT.
Really, for health questions.
Absolutely. Their data shows over 230 million people globally are asking health and wellness questions every single week.
Wow, that is a staggering number. So this product is meant to address that head on,
It is. And the core problem it's trying to solve is, well, it's fragmentation.
meaning my data is just all over the place.
Exactly. It's in one doctor's portal, another clinic system, your fitness apps, notes, your wearable. ChatGPT Health is basically designed to pull all of that together in one secure spot.
So you, the user, can actually feel like you have the full picture.
Right. You're more informed, more prepared.
Okay, so let's unpack that. If I'm listening to this, what can I actually do in this new space? What can I connect?
The list is pretty comprehensive. The big one is your clinical medical records.
How does that work? That sounds complicated.
In the U.S., they're doing it through a partnership with a company called BeWell.
Hold on, for anyone who doesn't know, what is BeWell?
You can think of them as a kind of secure digital highway. They specialize in pulling patient records from all these different, disconnected hospital systems and making them available to you.
Got it. And it's not just clinical data, right?
No, not at all. You can also connect your wellness apps, so Apple Health, MyFitnessPal, Weight Watchers, All Trails.
Even Instacart and Peloton are on the list, so the AI could literally know what you bought for dinner last week.
And that's what makes the personalization so powerful.
Right, so you can ask things like, how is my cholesterol trending? Or can you summarize my latest blood work before my doctor's appointment?
Exactly. Or even analyze your insurance options based on how you actually use healthcare. But, and this is a very hard line they draw, the tool is there to help you understand patterns.
Not for diagnosis.
Explicitly not for diagnosis or treatment. It's about navigation and support, not replacing a clinician.
That's a good disclaimer, but let's be realistic. With 230 million people asking questions, how do you stop them from using these insights for a little self-diagnosis?
Well, that tension is basically why the architecture is built on isolation.
What do you mean by that?
Health chats operate in their own separate space inside ChatGPT. They have separate memories, layered protections, even purpose-built encryption. Your health data is stored completely separately.
Okay, so if you had to point to the single most important technical promise here, what is it?
It's this, and this is the absolute headline for anyone worried about privacy.
Okay.
Conversations in health are not used to train the foundation models.
So this data never touches the big general AI training process.
Never. That's the safeguard. It's completely isolated.
And this focus on safety wasn't just an internal thing. I saw they worked pretty extensively with physicians.
Oh, absolutely. For over 2 years, they had more than 260 physicians in 60 countries giving feedback.
And what did that look like?
They provided feedback on model outputs over 600,000 times. That feedback directly shaped, how the model communicates risk or when it should tell you to see a doctor.
So all that feedback must have led to some kind of formal quality check, right?
Yeah.
A standard.
It did. It led to their assessment framework, which they call Health Bank.
Health bench. And what does it measure?
So this is key. It doesn't just check for generic accuracy, like, is this fact correct? It uses rubrics written by physicians to evaluate responses for clinical standards.
Such as?
Things like safety, clarity, and appropriate escalation of care. Is it telling you to seek help when it should?
So if we bring this all together, what's the big takeaway here?
I think there are two. The first is obviously the convenience of having all this personal data in one place.
But the second, and maybe more important, is that integration of clinical safety standards with all that personal context.
Exactly. It's your clinical history, your exercise patterns, your grocery list, all viewed through a lens that was built with physicians.
That synthesis redefines what it means to be an informed patient when you walk into a doctor's office.
It really does.
Which leaves you with a pretty important question to think about. How fundamentally will a constantly informed, AI-powered understanding of your personal health redefine the future relationship between patients and their doctors?